When you look at the goals related to maternal-child health, the bulk of them address pregnancy. So there's quite a long list here. Included in this is preconception planning, which will be discussed further in this lecture. If you recall from pediatrics, when we discussed neurotube defects, if we could just have women take folic acid prior to conceiving, we can modify that risk. There are many other things that we can address that decrease risks that can have adverse outcomes on a fetus. Another goal is to reduce the rate of women who are experiencing infertility. We also want to increase the rate of carrying a pregnancy to term. So although it looks like this goal wants to reduce the rate, what we're really talking about is reducing the incidence of premature labor, which is a complication of pregnancy. A very important goal is increasing the number of women who receive early and consistent prenatal care. This means that when they miss that period, they should be making an appointment to come in for that first prenatal visit. We want them to see us on a regular basis. Don't just come in for the first exam and then show up again in labor. There are many things that you will be learning about related to complications of pregnancy. If they are not discovered and addressed quickly, we can end up having a preterm birth, some type of morbidity related to the mother, or fetal death, which is devastating. We need to reduce the rate of maternal mortality. We're doing a fairly good job on this goal. We would like to decrease the rate of illness that occurs during a pregnancy as well as complications. And one of our biggest concerns is decreasing the rate of C-sections in low-risk women. And this includes women who have or have not had a previous cesarean delivery. There are some hospitals that have a C-section rate of 50 to 75%. We must question, were all of those cesarean sections really necessary? We need to reduce fetal exposure to toxins such as tobacco, alcohol, and illicit drugs. Additional goals includes increasing the proportion of pregnancies that are intended. We want to decrease the rate of repeat pregnancies within an 18-month period of delivering a previous baby. This is especially important in adolescence. We need to increase the education about the importance of delaying a pregnancy so that the body can recover and be in optimal shape for this next pregnancy. We want to prevent STDs, and we want to really encourage the use of a contraceptive method on a consistent basis instead of playing that maybe baby game. We need to increase the use of a contraceptive method when a woman does not desire a pregnancy. And once again, we really focus on the adolescent population. Moving beyond pregnancy, let's look at the Healthy People 2020 goals related to STDs, or sexually transmitted diseases. We want to decrease the rates of chlamydia in adolescents. We want to decrease the rate of PID in women, and PID is pelvic inflammatory disease that can destroy a woman's fallopian tubes and cause tremendous scarring. This has implications for developing ectopic pregnancy if a conception occurs, or in infertility. We're doing a fairly good job on decreasing the rates of gonorrhea, but we've been addressing this goal for decades. Another goal is to decrease the rates of primary and secondary syphilis. This also includes reducing the incidence of syphilis in a growing fetus. We screen for this in the first prenatal visit. As we move along the continuum in a woman's reproductive life, we cannot forget about vaccine-preventable illnesses. These illnesses have the potential to not only adversely affect the female patient, but her children and growing fetus as well. So included in this goal is preventing things like influenza. Have our female patients get an annual flu vaccine. You should be familiar with pertussis, as you needed to have this booster as you entered nursing school. You will learn when we get into prenatal care that pregnant women need to have a pertussis vaccine with each pregnancy. It's not just to protect her, but is going to protect her baby when they're born, because they do not have immunity for about 18 months after they receive the series of vaccines. We want to decrease the rate of all forms of hepatitis. We want to decrease the incidence of pneumococcal disease, and this is pertinent to women who have chronic lung disease and women after the age of 60. And last but not least, we want to vaccinate women against varicella. And in the adult population, we're addressing shingles, which is a very painful expression of the varicella virus in the nerve endings. It can recur at times of stress. So this vaccine is recommended after the age of 60. TB has been a part of the Healthy People 2020 goals since its inception. What we want to do is reduce the rates of transmission, and we also want to increase the rates of women who have a positive PPD that they have taken the full course of treatment. When we look at cancers, we're trying to decrease death from cancer. And how we do that is we want to find these cancers early so that we're decreasing diagnosis when it's already invasive or in its late stages. And breast, uterine, and cervical cancers are the primary cancers that this goal is addressing.